Bloomfield Hills, Michigan. So this is my third ruptured case in 24 hours. This is a patient, 71 years of age. She had a ultrasound done that showed rupture on the right side. She had a grade 4 contracture on the right and grade 3 on the left. Then she ended up getting an MRI, which showed that the rupture was on the left side and not on the right. So there was imaging discrepancy. Obviously, the ultrasound is just sound waves. It's not accurate. The MRI is the gold standard. The MRI without contrast. MRI is magnetic resonance imaging. This is no radiation. So this is just magnetic waves and no contrast. So it truly doesn't hurt. So she ended up getting that on her own. And lo and behold, it showed a rupture on the left side. So I just want to mention there was another report by someone mentioning CT scans. CT scans are dangerous. That's a lot of radiation, and they're not the recommended choice for looking at rupture of implants, silicone implants, and that is something that I would not recommend as a screening tool because the CT scans, again, is a lot of radiation for something used for screening. The MRI is the gold standard. So 71-year-old lady, one set of implants from 1997. Now one thing of interest is if you come and look on the right side, you will see the implant, it is all preserved, done in the en bloc fashion, complete en bloc 125/24 NT. Patient is actually an international patient. And as I put this, you can see how this is protruding out right here. And this is another protuberance right here, as you can see. And this was clearly visible. And this was what was above the muscle. So as you can see, it's paper thin, all preserved. So I'm going to go ahead and, so she had what was a mention of silicone implant. So as I cut this open, this is the only and ultimate way to figure out. And you can see how thin is this capsule. So as I go in, so very, very tight. I'm going to actually go in from the back. So hopefully I get a better access. You can see all of this tissue is not healthy. It does not look good, and that's why I removed it. I'm going to go in from here. There we go. I'm going to go in from here. Well, this was grade 4, very tight. So, one thing of note right here, you can see the implant is breaking down. If I go like this, you can see the slipperiness. The other thing is actually very interesting. This is your saline implant. It's not even silicone. So because it was so tight, it was hard to gauge as to see what it was, but this is a saline implant. So the MRI was indeed dead wrong. And you can see these calcifications right here. And look how super ultra thin this capsule is. Look at this right here. This is how thin the capsule is. Done all en bloc, and you have complete removal of the entire implant capsule, all inflamed tissue. Very tight, extremely tight. MRI is calling it silicone, and obviously they are wrong. The ultrasound is also wrong, and there is no rupture. Remember, the beauty of saline implant is when they do rupture, they collapse completely. Now, according to the MRI, this is supposed to be completely done en bloc, as you will see, complete removal of the entire implant capsule. And I'm going to go in right here. And you can see it's tight. If I go like this, she had this, what was protruding out of her skin. You can see it's like a sharp angle. And you will see this, how hard this is. This was sticking out of her very thin skin. And so we will see this is clearly, again, as I touch it, a saline implant and not silicone. And this only goes to show you this is actually an error in reading. Saline implants, the radiologist should have been very was not right. He made an error. He or she made an error. So I'm going to go in. I want to go in very slow. I do not want to damage. Remember, there are some calcifications. I'm going to find the right entry point. You can see how thin the capsule is. Let me go in from here. All right, here we go. Complete removal of the entire implant capsule and all inflamed tissue. I'm going to switch this around so it doesn't hurt the capsule. No matter how thin the capsule is, look at this, you can see my scissor. It has to be removed completely. That is what has been shown by the many patients who had their capsules left behind and they did not improve, and from the many pathology reports that show that there is silica. And as you'll see, look at the way this is folded up on itself. And I'm going to use my hands to tear. I don't want to take the chance. And look at this small amount of fluid around, how it was literally collapsed on itself. And you can see after so many years, this is going to get a chance to open up right here. So some fluid around. You can see this is your gel bleed. And you can see the implants like breaking down. It has these sandpaper consistencies. So over here, as you will see, this is the number 6 and the 2 arrows and intact saline implant. And as you will see right here, look at the calcifications that have formed. Look at, it's dark actually on the inside, so we're going to go ahead and send this off to pathology, and cultures have been done. You see how it's a little bit on the dark side. You can see again, if I show how transparent thin this is, and look at that white chalk type consistency. And if you look over here, look at the consistency over here, and all of this tissue has to be removed because it's inflamed. It does not look healthy. So very interesting last 48 hours. Yesterday we had a case where she was told she has saline and she ended up getting silicone, one of which was ruptured. The lady from yesterday, she was told she has saline implants, she had silicone, and she was indeed below the muscle, not above, and she was ruptured. So 3 discrepancies in her. The case today, the ultrasound showed that the right one was ruptured, the MRI showed the left one was ruptured, and it turns out that it was saline implants, so she should not have had any imaging, because saline implants, when they do rupture, they collapse completely. And I must mention the case earlier today was a young lady in her early 30s, mom of 3 kids. She was actively nursing her baby, and it turned out that she had pain, got an MRI, which showed a rupture, and indeed she had what was a rupture on the right side. So this was the case done earlier today. It's 3:24, and I've just done 2 cases, and this is basically goes into showing you that the explant surgery, I booked everyone for 4 hours. This lady, she waited almost 2.5 hours before she came in. into the operating room. And again, no one can tell how long and what it's going to take. But one thing is for sure, the entire absolute determination is made that the surgery needs to be done safely, definitively, and completely, where the entire capsule is removed along with the implant plus all inflamed tissue, and that this capsule is sent to pathology to rule out the BILCL, which is very rare of rare, but still needs to be tested with CD30 analysis. Culture needs to be done to show that, you know, this is not, see this darkness that you see, is not potentially fungus. Now remember, fungus is very rare. You see, if you see right here, it's a little bit on the dark side. Fungus is very, very rare, but still needs to be ruled out. And then we have to make sure that the surgery is done in a very definitive manner, such that all of that capsule is removed completely, sincerely, definitively, such that post-op there's only good, healthy, viable tissue behind. And we know this for a fact because of two reasons. We know of the many patients that had the capsule left behind. Only when did they go back to remove the residual capsules did they improve completely, definitively, and very dramatically compared to when they had those residual capsules. And number two, we know the many pathology reports that tell us of the non-polarizable material consistent with silica, not in all of the samples, but in the many samples that we have seen, along with histocytic reaction, giant cell reaction, silicon particles noted within, and you can hear and see them, these calcifications. You don't want to be leaving this behind. Look at this very hard, what is this, calcification slash possible silica, I do not know. So there you have it, the gold standard, which is to remove it completely. So if it was silicone, we were prepared. I was prepared, just like in the first patient today, this patient, the patient from yesterday, and all those many patients that have had ruptured silicone implants. And I must mention in conclusion, twilight sedation, I do, no drains, no lift, capsule sent to pathology, cultures done for microbiology, implants are always returned to the patient, and all patients get the same surgeries regardless of their age. So this 71-year-old got the same surgery the 33-year-old did earlier this morning, and the 47-year-old patient yesterday. And then last but not least, the videos and pictures are done so that the patients know exactly what was done, such as this, and what remains on the chest, which is no capsule, and the entire implant capsule is removed as one system in the en bloc fashion, as you see, or 100% total capsulectomy, so the patient has the best chance to bounce back and has the peace of mind that there is no inflammatory burden left behind. This is Dr. Khan, Executive Plastic Surgery.
So neither one of them are ruptured.
Yes,